As we saw in our last discussion of illness and wellness in world history, the 19th century saw dramatic changes in the medical community. The emergence of the clinical school in Paris in the first half of the century changed the way doctors were trained, tested, and supervised. The German lab revolution in the middle of the century brought scientific methodology to medicine as doctors began to study pathology and physiology systematically, applying the same principles of science to the applied nature of medicine. And the work of men like John Snow, Louis Pasteur, Joseph Lister, and Robert Koch definitively proved the validity of the germ theory of disease, which is basically the idea that disease is caused by microorganisms. By about 1900, the germ theory of disease had been accepted by the scientific community and displaced the miasma theory that had kind of prevailed in medicine up until that point. These 19th century changes then paved the way for a dramatically new approach to medicine in the 20th and 21st centuries. So in this video, we're going to be taking a look at this new approach to medicine in the 20th century and continuing on into the 21st century by looking at some of the advances, the results, and the challenges that accompanied medicine in kind of our modern world. Please note that as we go through this video, this list is by no means exhaustive. I'm just going to be pointing out some of the key advances and key challenges, but there are others that have become or that have been profoundly influential in 20th century and 21st century medicine as well. So let's start by taking a look at the new advances in medicine in the 20th century, many of which were kind of built on the lab revolution of the 19th century. So number one, the first kind of advance that we could point to was a focus within the medical community and within the public health community on sanitation and sterilization. There was a push for antisepsis within the medical community, specifically during medical procedures, and a focus on the importance of sanitation, particularly in urban areas, but in any place where humans come into contact with each other. This approach or this focus on sanitation and sterilization would be profound or would be profoundly important in driving better health outcomes in the 20th century. A second key advance actually has nothing to do with the science itself and has more to do with the scientific community. The second advance that we can point to was an advance in communication. The so-called communication revolution that characterized the 20th century, kind of beginning with the telegraph and the telephone and continuing on through the internet and email, made communication easier. And by extension, it made communication between scientists easier. So the scientific community and the exchange of scientific ideas truly became global. This was matched by global institutions like the World Health Organization, who tried to approach medical problems from a global perspective. This global cooperation contributed to rapid advances in medicine, and the creation of the first immortal cell line in 1951, known as the HeLa cells, allowed for seemingly limitless experimentation. So the 20th century kind of built on the 19th century lab revolution and carried it forward. A third key advance that we could point to in 20th century medicine was the emergence of new pharmaceutical drugs. Arguably, the most significant was the discovery or the development of insulin in 1922, so that diabetes was no longer universally fatal, and the discovery in 1928 of penicillin and the other antibiotics that derived from penicillin in the future. This allowed medicine to kind of win the war or at least win some battles, maybe a better way of saying it, against bacterial infections. Those might be the two most significant. Again, it's arguable, but they might be the two most significant. But there were thousands of drugs developed in the 20th and 21st centuries. From the staples in your medicine cabinet, things like pain relievers and fever reducers, aspirin, acetaminophen, ibuprofen, to commonly filled prescriptions like SSRIs, birth control pills, and Valium, to medicines that gave humans a fighting chance against diseases once considered untreatable, like cancer or AIDS. The 20th century saw a glut of these new pharmaceutical drugs to help treat and cure diseases. A fourth key advance in 20th century medicine would be the emergence of new vaccinations. Dozens of new vaccinations reflected a shift to preventative medicine. Vaccinations against things like typhus, tuberculosis, measles, polio, influenza. They all helped to control the spread of this disease through prevention rather than treatment. By 1980, the vaccination movement had had its first complete success with the eradication of the smallpox virus from the world. The medical community created global health education campaigns, trying to ensure that enough people were vaccinated to create herd immunity. So this is shifting the nature of the public health movement to a global health movement focused on prevention. Another key advance was new medical imaging techniques. Developments like the ultrasound, CAT scans, and the MRI opened the body to further exploration, increased understanding, and new approaches to treating disease. And then finally, after the 1970s, after 1973, the so-called genetic revolution opened a whole new world for medicine. Understanding the human genome led to a better understanding of some diseases and pathologies, and eventually paved the way for genetic engineering, which resulted in the creation of things like synthetic insulin and growth hormones for underdeveloped children. So these 6 key advances, among others, improved health outcomes in the 20th century for the global population. The result was a dramatic increase in life expectancy across the globe. Take a look at this map from 2013, which shows the life expectancy in that year. Industrialized nations, or in industrialized nations, life expectancy probably averaged somewhere in the upper 70s, ranging from about 75 in China to 83 in Japan. Compare that to the 1900s, compare that to 1900, when life expectancy probably hovered somewhere around the mid-30s. There are still inequities in health outcomes by country and region. The upward trend overall has been universal. And this has meant new challenges for 20th century medicine. Medicine has had to shift to deal with the needs of a population that's living longer, meaning that doctors and the medical community aren't just dealing with the treatment of acute diseases, but increasingly with chronic and age-related diseases. The medical community no longer just has to deal with the absence of disease, but they're focused on the presence and maintenance of health. Another challenge that you could point to in 20th century medicine is the impact of industrial warfare. First half of the 20th century opened with 2 major world wars that were devastating in terms of their impact on human life and human health. There were hundreds of millions of casualties of the first 2 world wars. Casualties defined to include death, injury, permanent disability. And that put intense pressure on the medical communities. Medics and mobile hospitals were created to deal with battlefield trauma. Often these doctors were forced to adapt on the fly with limited resources. and that contributed to rapid advances in trauma medicine. World War I, for example, is widely credited with establishing the modern ambulance, or the modern approach to the ambulance, to antiseptics, and to anesthesia. Ambulances became necessary to get people from the battlefield to the hospital sites. New antiseptics were developed to fight gangrene and other infections that threatened the lives of soldiers even more than their injuries did. And anesthesia allowed for more intricate surgical procedures so that the first instinct didn't have to be amputation. So World War I changed trauma medicine, and trauma medicine changed overall medicine. Military medicine is often a driving force in medical changes throughout medical history. Another key challenge faced by the medical community in the 20th century was the rise of the pandemic. Epidemics, that scourge of human history that we've talked about again and again, didn't just end because of the medical advances that accompanied the 20th century. At the same time that you have these medical advances, you have a world that's becoming even more tightly connected. Air travel in particular connected disparate communities with a sort of immediacy that allowed the spread of diseases. A pandemic is an epidemic of worldwide proportions, and the 20th century has seen three that come to mind, three that were particularly significant. The first was the 1918 Spanish flu pandemic, which was one of the deadliest pandemics in human history. The Spanish flu infected about a third of the world's population and resulted in somewhere around 50 million deaths in a period of roughly 2 years. In 1957, the Asian flu pandemic claimed millions of lives, and in 1968, the Hong Kong flu was classified as a pandemic. And there were pandemic threats, like the 1970s threat of a swine flu pandemic, the 1990s threat of the avian or bird flu pandemic, and the early 2000s SARS pandemic or pandemic threat. So the 20th and 21st centuries are kind of constantly dealing with this threat of a worldwide pandemic, of a disease that spreads very rapidly and almost uncontrollably through the worldwide population. Another challenge that kind of has to be dealt with by 20th and 21st century doctors and the medical community is the question of ethics and ethics violations. It kind of comes down to that shorthand, which is just because you can doesn't mean that you should. And so the 20th century was in many ways defined, medicine in the 20th century was in many ways defined by doctors seeing what they could do, doctors and medical researchers seeing what they could do. And oftentimes the question of whether they should fell by the wayside. Let's go back to the HeLa cells that I mentioned earlier in this video. We talked about the HeLa cells as the foundation of a tremendous number of medical advances, and they were. The HeLa cells established the first immortal cell line, which meant that it was a cell line that didn't die. So up until the HeLa cells, medical researchers, cell researchers spent as much time trying to keep their cells alive as they did performing experiments on them. And so the HeLa cells just allowed for researchers to replace cells in failed experiments and start over. And this was huge in transforming the medical community and medical advances. It facilitated a tremendous amount of worldwide medical experimentation and resulted in countless advances in medical treatments. But those HeLa cells were taken from a woman, an African-American woman in Baltimore named Henrietta Lacks, who died of cancer in 1951, without her knowledge or permission. Neither she nor her family received any compensation or recognition for their contribution. even though a billion-dollar pharmaceutical industry was built on her cells. So there's the question of ethics and ethics violations. We could go back in the 1930s to what would become known as the Tuskegee syphilis experiments, when 622 poor African American sharecroppers in Alabama were knowingly infected with syphilis and left untreated so that doctors could see the effects of the disease as it progressed. Many died, many others suffered in misery. They passed the disease onto their wives. Some had children born with congenital syphilis. So the misery and suffering that resulted from the Tuskegee syphilis experiments was profound. In 1946, this was followed by the Guatemala syphilis experiments, where doctors infected soldiers, prostitutes, prisoners, and mental patients with syphilis and other sexually transmitted disease without their knowledge or permission. They treated most, but not all, with penicillin, but still it resulted in 83 deaths. Or you could look at the medical experiments, the Nazi medical experiments during the Holocaust, when Nazi doctors performed multiple experiments on concentration camp prisoners. Often they would mimic the trauma of battlefield injury or infect these patients with diseases to track the results. This caused a tremendous amount of suffering among these, the sort of victims of these experiments. And even as recently as 1996, there have been cases involving pharmaceutical experimentation in African nations. In 1996, for example, there was a clinical trial in Nigeria involving a drug to treat meningitis. The results included more than 200 children being disabled, 11 dying, all done without the knowledge or without what medical researchers now call informed consent. This has had long-lasting ramifications, particularly within these disenfranchised areas where maybe unethical medical experimentation has taken place. There is a widespread distrust of vaccinations in the medical community in large parts of Africa, for example, as a result of these experiments. And that has profound ramifications for the global health community. So the question of ethics and ethics violations in medical experimentation is one that's still being dealt with in the 21st century. Another challenge that we could point to is unequal access to health care. In a century, or a little over a century, in which you've seen dramatic strides in life expectancy, the ability to treat diseases, the ability to live with what had previously been untreatable diseases. Even as healthcare has improved, not everyone has equal access. Take a look at this map, which shows the World Health Organization's judgments of access to healthcare. As of 2015, the WHO estimates that some 400 million people lack access to essential health care globally, and it's particularly bad among the world's poorest nations. And even in nations that have strong health care and have access to health care for many, that there's still not universal access, particularly among the poorer communities. So the last key challenge that we want to talk about pertaining to the 20th century medical community is the question of universal health care. The question of the government's role in ensuring its citizens' access to health care first became a topic during the French Revolution, when revolutionaries set out to establish a broad social assistance program that included access to health care. Their attempt was ultimately unsuccessful, but it does mark the first attempt at universal health care. There were some attempts in the late 19th and early 20th century, but the question of universal access to health care really became a topic of discussion with the emergence of the social welfare state in the Great Worldwide Depression of the 1930s. The social welfare state was built on the idea that a government can and should play a role in promoting the social and economic well-being of its citizens. For many, this included ensuring access to health care, because in their mind, a healthy community is a successful community, and that global health was the responsibility of the global community. After World War II, national health care programs spread across the globe, as you can see in this map. But it hasn't always been easy, and it hasn't been without debate. So the big question to come out of these universal health care debates is about the role of government, society, and the international community in global health. And in many ways, those are the essential questions of the history of medicine in the 20th and 21st century. You see individual medicine give way to public health, and public health give way to global health initiatives. So what role do people and governments and societies and communities and cultures play in ensuring the global health of the population? It's a question that has shaped the 20th and 21st centuries, and I would imagine a question that will continue to shape the world in which we live as we push into more 21st century medical advances. Thank you.